Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Today I'm going to talk about some facts about carpal tunnel syndrome and also some great ways you can prevent it and decrease the intensity of the symptoms. So what's carpal tunnel? Well, carpal tunnel is a painful condition which affects the hands, and about 4% of the general population suffers with it. Now, it's becoming increasingly common among teenagers and young adults too, because of extensive electronic usage like laptops, smartphones, tablets, etc. So while it was more common in middle-aged and elderly people, it's now becoming more and more popular, or common rather, in the younger populations too. So some common symptoms with carpal tunnel syndrome are numbness, loss of feeling, tingling in the hands, especially in the index finger and the thumb. Also, there's pain and throbbing in the fingers, hand, and forearm. You can have difficulty moving the hand normally. Unusual sensations throughout the hand and fingers are also a hallmark of this condition. Pain that extends up the forearm toward the shoulder, muscle weakness and shaking in the hand. Also occurs weakened grip, loss of strength in the hand, trouble performing movements that require a steady hand, throbbing and swelling, including at night, and pain that wakes you up as well. Also sometimes a loss of awareness of where your hands are in space. That's another common manifestation of this condition. So common risk factors are performing repetitive movements with the hands or the lower arms, regularly performing movements that involve extreme flexion or extension of the hand and wrist. That's extreme forward and backward bending of the wrist. So commonly, who's this, most commonly afflicted with this? Well, people who work on the computer for many hours every day. That's probably the most common. Carpenters, butchers, chefs, people use their hands a lot in repetitive fashion. Musicians, mechanics, landscapers, also athletes, rowers, golfers, cyclists, and tennis players, because they're always flexing and extending their wrists. So what are some really good ways you can prevent carpal tunnel? Well, stretching your wrist and hands is important. Doing stretching exercises, especially that will stretch the flexors and extensors of the hands, of the forearms, and balance those out, thus taking pressure off the carpal tunnel. That's important. Don't grip things too hard either, because that overexerts the forearm muscles, the flexors especially. Use better equipment and also bigger tools. If you work with your hands, you're a carpenter or a mechanic, let the tools do the work instead of your body, instead of your hands. Practice good posture and ergonomics. That's a big one. It's something I tell my patients all the time. And also having an anti-inflammatory diet and natural supplements that decrease inflammation in the body, because that's another big contributor to carpal tunnel, is inflammation in the body. And then lastly, getting checked by a chiropractor. Adjustments of the neck, the shoulders, and also the arms, including the wrists and hands, are very important, and decreasing the likelihood that you'll get carpal tunnel, and also will help can help a lot with the symptoms of carpal tunnel. So if you want more information on this, check us out at newhopechiropractic.com, and we're always available for a complimentary consultation to see if chiropractic can help you with this. And have a healthy day.